co-host is attending to other urgent issues. But as usual, we are going to start with introducing our panelists. We are still expecting one. Let me start with Dr. Chioma.
Hello, everyone. My name is Dr. Chioma Ogunedo. I live in Boston, Massachusetts, and I'm a nurse practitioner, family nurse practitioner by profession. And I'm here this afternoon, excited to be with all of you.
And that's very
Happy
good.
Sunday.
And I'm going to invite the chief host, Dr. Kena Osando. Introduce yourself and introduce the program too.
Hello, everyone. This is Tina Menokor. I am a family nurse practitioner, and I'm also a mental health nurse practitioner in Dallas, Texas. Welcome to the show. Welcome to our viewers from all over the world. Today, we are going to treat another important disease condition, arthritis. Many people suffer from it. It worsens with age. The types of arthritis, there are different types of arthritis that people may encounter. Whichever arthritis people have, it impacts their lives in such a huge way. And today we want to look at what causes it, how can it be mitigated, and how can people get through it and still live a near normal life. So welcome to the show, and we will show you today with our panelists on the little things you can do to still enjoy, have a fulfilled and enjoyable life. Thank you.
That's very great. And Dr. Jamal, we are going to start right away by give us an explanation of what arthritis is. If a layman is hearing you talk of arthritis, can you put it in a language that the non-professionals can understand what you are talking about?
Thank you, Mr. Alex. Arthritis, we have different types of arthritis. But the two major ones that I think that we see and we hear about all the time is osteoarthritis and rheumatoid arthritis. We also have the ones that is caused by gout, psoriasis, but I think we'll for this show today, for the layman, we're going to concentrate on the osteoarthritis, which is an arthritis that happens with age. It's mostly seen in older people, and it affects your cartilage. Your cartilage is that thing in between two joints, and it also affects mostly weight-bearing joints. Let's talk about the knee. If you have osteoarthritis, the bones that are associated with your knee, the lower one and the top one, they start to rub and come together. There's a friction because what is there, the cartilage is off. So that is osteoarthritis for the layman. We're trying to make it so that everyone can understand us. Therefore, the rheumatoid arthritis, which can start at any age, is an arthritis that is caused by autoimmune problem when your immune system starts to attack your bones. So what happens in this case is that your white blood cells will rush to the point of your joints, and it doesn't affect, it's mostly all the joints of the body. It's systemic, it's all over your body. It can happen to your fingers, it can happen to your waist, your wrists, your knees. And at this point, the white blood cells goes in between the bones and start to attack the synovial fluid, the synovial cells that are there, and then you have an inflammation of the joints. So that's what rheumatoid arthritis is. So I think if we can focus on these two today, a lot of our viewers will gain so much from what we are doing. Thank you.
Okay, Dr. Law Osando, I'm welcoming you to the program, and
thank you. I say thank you for welcoming me, and for the audience. We appreciate you being here today, and we're back here to do our best to get you informed about the health issues. Thank you so much.
Okay. Dr. Kena, over to you.
Right, Dr. Law.
Yeah.
How would people know the difference if they are suffering from osteoarthritis or rheumatoid arthritis?
Well, basically, osteoarthritis is a gradual degeneration of the joint. It takes some time, it's gradual. And whereas rheumatoid arthritis is more acute in the sense that it attacks you, gives you a lot of pains, and you cannot stand the pain unless you get help. Whereas osteoarthritis is gradual, it may do today and not do tomorrow. The next time it does 2 times a day, and gradually you begin to feel the pain. The joint becomes weak because the cartilage that cushions the two bones is now thin, and therefore you see a kind of bone-to-bone articulation, and it's causing a lot of pains. It's more gradual, and it happens due to old age. Rheumatoid arthritis, though, comes usually from middle age upwards, but it's something that attacks your system such that it becomes too uncomfortable for you to handle by yourself, and you need to get help. So that's an ordinary way of differentiating them. Thank you.
Okay. Dr. Law, let me still on you. How do you really begin to, a layman who begins to notice this discomfort? How do you really know that is arthritis? Because sometimes what might be happening there may not be arthritis. So what are some of the distinguishing features or symptoms you will know so that you know where to go?
Well, usually the most discomforting thing that happens there is one is pain, inflammation, swelling of the joints, and sometimes it has some other ways of manifesting. Uh, Even if you're lying down, you're not using your legs, sometimes you get occasional pain in the joint, and it comes frequently. You're trying to go up a flight of staircase, you are not able to move at some point, you have to slow down. So these are the way you know that this is arthritis, and it comes with age. I don't expect that somebody in his 20s will show some of these symptoms. If something is happening at that age, then it's something else. So age will give you an idea of what is going on. Another thing is that if it's an injury, you had an injury on a particular joint at some point, then you can always know that that is not arthritis, it is injury, because you had already had an injury at that point. Maybe you tore something there at some point it was not fixed. Some of them could be things, ligaments. So if you had an injury at that point, you are not going to consider that as arthritis. It is something that damaged that needs repair. So if it is not injury, it's not coming at an earlier age, then we easily say this is arthritis.
Dr. Choma, while we're on that topic, I've heard a lot of people, say that they get arthritis at a site that they had an old injury. Is that, something, that people should be concerned about following injuries? Do they automatically get arthritis?
It's not an automatic thing that you get arthritis, but as Dr. Law said, when you're aging, the bones, the fluid in between your bones starts to decrease, and then you can get. So if you've had an injury on your knee, like for instance, the people who do sports, there's a tendency that you will have arthritis more than someone who never had any injury to that site. So when they say they're having arthritis due to all the injury, it's because they're progressing in age, and also life is happening. So that's the only thing I can say about that. But I wanted to add something to what Dr. Law said about how do you know if it's arthritis or something else. So for instance, if you look at your fingers, and you start to have bumps on your fingers, okay, and it's stiff in the morning, but it's not more than 30 minutes, it's less than 30 minutes. That stiffness, pain, bump on your joint could be osteoarthritis. But if you have swollen fingers, inflamed fingers, or any part of your joint is inflamed, is swollen, and the pain lasts more than 30 minutes in the morning, then you can be looking at rheumatoid arthritis. But okay, you know you have rheumatoid arthritis or you have osteoarthritis. What do you do next? Or you're suspecting it. What do you do next? Next, as a layperson. So I just wanted to add that to what he said. Thank you. I hope I answered your question.
Thank you.
And so this arthritis, which Dr. Law has described, comes mostly at old age. So does it come progressively, or does it just come down? Is it a progressive development, Dr. Law?
Yeah, osteoarthritis could be progressive, and once the joints begin to have that problem of degeneration, and this degeneration comes in many forms. Sometimes some of the joints fuse together, especially that of the spine. Sometimes the knees lock because some of the cushions and some of the ligaments that keep them in a particular situation, position, are no longer effective. They have already been eroded. So it's progressive. Gradually, it gets to the point where you cannot use that joint anymore, depending on the individual. And therefore, you have to do a knee replacement or a joint replacement, or you go to an orthopedist who goes put some pins and rods in the place and separate them and do something like laminectomy. So it's progressive. And depending on the individuals, there may be nothing to be done about it, or you could go for some kind of surgery, depending on how good you are, whether you can, at that stage, be able to handle complex surgery and so on. So it's usually progressive. It goes from one stage to another to get to the point where you can't use that joint anymore. So that's the way it's
Dr. Kina?
Yeah, Dr. Choma, I know there are different types of tests to diagnose arthritis versus rheumatoid arthritis. Could you let our viewers know how they can get a definite diagnosis of what's going on their body?
Oh, thank you. When you have persistent pain and you're showing any signs of arthritis, usually doctors will send you, first of all, for X-ray. X-ray only visualizes the bones. So when the radiologist looks at the X-ray, if they're seeing bone spurs, they can say, "Oh, this is osteoarthritis." If they're seeing your bones fused together and there are no bone spurs, then they can say, "Oh, this person is beginning to have a fusion of the bones, and it could be rheumatoid arthritis."
You're freezing. You're freezing, Chioma.
Hello?
Yeah, go ahead.
Okay, so the doctor can send the individual for lab tests like RA factors and erythropoietin tests, to see how much blood cells you have and your kidneys are functioning. Anemia is a classic sign of rheumatoid arthritis. So it's the doctor that determines, or your provider. So if you go to your provider is now trying to find out, X-ray is showing this. What next can I do? And you go for the lab test and the results come out, and he can now have a definite answer to say, yes, this is rheumatoid or osteoarthritis. Like Dr. Law mentioned, he said degenerative disease. Osteoarthritis is also known as degenerative disc disease because your bones are coming together and are wearing out. Thank you.
Okay. So let us look at the issue. We have been able to identify some of the causes. We have been able to identify the is process. But is it possible to avoid it, or must it come to pass? Dr. Law, let me start with you.
Yes, arthritis, like other conditions, may have predisposing factors. Some people may inherit such uh, conditions and such propensity to have arthritis of any kind, and some people may not. There are people who get to 100 years and they don't complain of any significant joint issues or problems. So it might be maybe you inherited some of those factors from your parents. And if you, some people may have during their lifetime been very active in one area or another. You played basketball, you played soccer, and some of those things eventually come back at old age to haunt the joints, because those are the joints we actively used when we were in the youth. So it and it's not to say that if you have rested all your life, you may not have arthritis. It may also lack of exercise also may also come back to have its own effect. So there's no way to determine who's going to have osteoarthritis and who's not going to have. It is if it eventually happens to you, when you get to the bridge, you cross it. If it doesn't happen to you, you thank your God. At my age now, I'm 60 something, because I'm beginning to feel a little bit of pain in my joints. I don't look to do anything about it, because people just say, "Awakawa ebewe." There are certain things you have to live with for the rest of your life. So it's not every pain that you get that you need to go and do something about. Some of them things you have to live with. Try to relax, and at the same time exercise. A little bit of this and a little bit of that. You cannot do all of them, because that will be negative. Thank you.
Chioma, you're just smiling. It appears you want to make some contributions on this area.
No, I was just enjoying what he was saying and the way he said it. That he's getting old and
So
so
you don't have anything to add?
no, what I wanted to add to it is that sedentary life, being obese, and also use it. If you think about osteoarthritis, it usually affects our weight-bearing joints. And which ones are these weight-bearing joints? Your back, your spine is one of them. Your knee, your hip. So if you're overweight, there's also a tendency that you can have osteoarthritis. Another risk factor for rheumatoid arthritis is being female. If you're a woman and it runs in your family, yes, you can end up having rheumatoid arthritis. And like we already mentioned, age and injury. So that's the only thing I needed to add to what Dr. Law was saying.
Okay. You
You
know,
still are using
I want I wanted to add a few more things
okay, that's good.
on some of the risk factors, including smoking, alcohol intake. Those are some of the things that increases your risk for osteoarthritis. Lack of vitamin C and vitamin D. Vitamin D is very critical for our health. Your overall um, um, oral health is very important. Like Dr. Choma said, maintaining a good BMI, your weight, and staying active and reducing pollutants. So these are eating healthy also. Every time we have this show, it boils down to the same things over and over again. Eating healthy, making sure you're taking enough antioxidants that help destroy some of the bad cells that are in the body. So those are some of the other risk factors that people may encounter that will make them more susceptible to having osteoarthritis. I just wanted to add those two.
Yeah, I would like to also say something about what Dr. Kina just said. The use of vitamin D to the body can never be overemphasized. On the average, I don't think in recent times I've checked anybody's vitamin D level and it is normal. Usually they are very low. Most people, whites and blacks, everybody. And even those who are normal are the lower side of normal. It goes between 30 to 100. I've seen people very often. The best I've seen is about 30 something. So you cannot get enough vitamin D. So people who are on vitamin D should continue to be on vitamin D because it has proved to help a lot in autoimmune conditions. And arthritis is one of those conditions that lack of vitamin D can affect adversely. So please, people should look at vitamin D very seriously.
I have a question for you.
Yes.
Apart from drinking those tabs, is it not possible to get vitamin D through the sun like we do in Africa?
Yes. I listened to somebody's program a few days ago, and he listed some of the conditions those who are upper or the North Pole have that those in the equator don't. And he attributed it to vitamin D. The more sun you're exposed to, the more vitamin D you can get. But the whiter you are, the more vitamin D you make with the small sun you get. So even our pigments prevent us from getting enough vitamin D. I mean, the black rice. So we make a lot of vitamin D with the sun. Usually the ultraviolet ones in the mornings, but we are not making enough. I don't know why. Because we stay in the house most of the time. Most people stay indoors because of weather conditions and the sun. So you don't want to get cancer from the sun, and you go inside, and then you get the opposite of it. So that's what I think.
Okay, Gina. Over to
Yeah.
you.
Well, I wanted to see if you had a follow-up question on vitamin D because vitamin D is so critical. Like Dr. Lord said, people are never optimal, and whenever they get vitamin D, when we draw the labs, everybody's on the low numbers, and you can hardly see anybody past 30. I tell everybody needs to be on vitamin D, because it's very critical for your hormone. It's very critical for even helping with your antioxidants in the body to fight all the free radicals. So, and when you have less free radicals, your body tends to get less diseased. So vitamin D, any day, every day. All right. So while we're on ways that we can mitigate osteoarthritis, what other things how is arthritis treated? Dr. Chama?
Oh, thank you. Well, if you're diagnosed as having osteoarthritis, let me start with that. Most of my clients, they will say, oh, pain. So the doctor prescribes NSAIDs, non-steroidal anti-inflammatory drugs, something like ibuprofen. But the downside of this is that too much of it is not good for you. So you're always advised, please eat before you take this medication and don't overtake it. It's something that you take maybe once in the morning so that it can help you move your joints and you can go your merry way and do your jobs. Common Tylenol is also good. Another treatment, if this does not work, the doctors can now, or providers, I like to use that word providers because there are a lot of people now who take care of clients. Your primary care provider can refer you to pain clinic or ortho clinic, and they'll give you steroidal injections, not PO, not by mouth, into your joints that is affected. But the downsides of this medication is that it doesn't last for a long time. It lasts for like 1 or 2 months and you start to feel the pain again. But what I advise my clients is that if you get the injection, start exercising, start doing, not running, not playing tennis or something like that. We can do swimming exercises, you can do yoga, things that will help you move your joints. That's very important. When it gets so bad, the client might need surgery. And at that point, that's when you hear about knee replacement or any kind of joint replacement where it's affected, where your joints are affected. But when it's rheumatoid arthritis, that becomes a bigger issue because it's an autoimmune disease and it's good to diagnose it early. And the reason I'm saying this is that it's very debilitating. If it's not diagnosed early, you can have very chronic debilitating disease, that pain that you now feel like you want to die instead of being alive. So the doctors or providers will place you on a rheumatologist, because right now you're not going to be seeing just any other provider. You'll be seeing someone who is specialized in rheumatoid arthritis. They will cure you with things you won't believe it. The medication we used to take in Africa when we were young for malaria, which is chloroquine, is one of the medications they use for treating rheumatoid arthritis. But if you're on chloroquine, you have to be careful because it affects your vision. But even before they get to that point, they will start you with pain medications, and you're taking the pain medications. They place you on things like chloroquine, methotrexate, and they will direct you on how to take them. That, like the methotrexate, which is called the DMAPs, the class of medicines. You have to take them like once every week, like 7 tablets once a week, or you can be placed on oral corticosteroids. And remember, rheumatoid arthritis is an autoimmune disease. So they're giving you the steroids orally to suppress your immune system so that your immune system will stop fighting your body. But, everything has a side effect. So, but the best thing is early diagnosis and treatment by your provider. Thank you.
Yeah, Dr. Law, what part of the body does RA manifest, also any of these manifests? What part of the body? Where do you normally notice it?
Well, both RA and osteo they attack the joints. And most of the times, if it's RA, it's unmistakable. Nobody will tell you you're spying the mountain. You will be very uncomfortable that you have to seek for medical attention so that they give you the medications. Very often, when I get such cases, I just refer to rheumatologists. They have special training about how to take care of those. Some of those medications they give, some of them are even like chemo. They have very serious effects, and it's not what I try to do on my own. I refer them out to those who are specialized in it. But if it's regular osteoarthritis, your joints will be aching. And then some of the time, like I said, all you need to do is take medication like Dr. Chema said, and then to relieve the pain. But that doesn't mean the pain will go away. Like she said also, you need to do some exercise. If your knees are hurting, then if you continue to do more exercise with those knees, they continue to cause more problems. So that's why swimming is recommended in such cases, so that you don't have to put a heavy load on your knee. So sometimes it is a hopeless situation where you don't know exactly what to do. You can't stay still, you can't move around, but you have to find a way to at least keep your whole body active. There are so many other ways of doing it. There are things you pull sitting on a place. There are certain bouncy balls you can sit on and bounce without having to involve your knee for too long. There are so many exercise tools you can use to get yourself. And you can also go to a physical therapist or a chiropractor. And there are certain devices they use these days, like lesser shooting devices they use to go through the joints and warm the plates and give you some temporary comfort and then last for some time, but it may come back, it may not come back. So it is just, it becomes a way of life till you start, yeah, God takes you home. So that's what I have to say about it.
Tina?
Yeah, as we're touching things that can help to reduce the pain and discomfort, there are so many alternative measures that the patients can take. Dr. Choma, could you highlight those for us?
Uh, yeah, dealing with senior citizens, sometimes you hear all kinds of things. And one thing I always tell them is what works for you is just continue. Like I met a client who said to me, I drink pickle juice, and she swears by it, pickle juice. She gets the pickle in the bottle and pours out that juice every morning and she drinks it. 2 days ago, I met one who drinks cherry tart juice, and the only place you can find it is a place like Whole Foods. She buys it and she mixes it with water. And she said for 3 years she has not taken any Tylenol or ibuprofen. And I said that's good for your osteoarthritis. So it works for her. So exercise therapy is one. Taking like doing homeopathic medicine. Uh, for instance, those of us from Africa, the shea butter, ori, that we rub on our joints when we have pain is also an effective measure. It doesn't mean that you have to swallow pills all the time to get well. There are things that you can, use that is native to your area, and you can share it with other people and let them try it. I believe in trying things, not always the pharmaceutical way all the time. So hot heating pads, cold compresses can relieve you of pain. Like Dr. Law said, exercises, your doctor can refer you first to PTOT, and they will teach you how, especially for those who have rheumatoid arthritis. Remember, it deforms your fingers. And one thing with rheumatoid arthritis is that it's symmetrical. If it's happening on right hand, it's also happening on your left hand. So the client might get depressed because things they used to do before, like opening up cans, buttoning their shirts, will be a problem. So they will teach you on how to use aids, devices to do all those things. So there are a lot of things out there that you can ask questions by being in a support group where other people are suffering from the same thing you're suffering from, and they can tell you what they're doing to alleviate their symptoms.
Yeah. Okay. Somebody want to talk? Okay, I was thinking. So what I'm saying is, it this arthritis, where is it prevalent? Is it more prevalent in Africa, or is it more prevalent here? And what do you think are the factors responsible for that? Dr. Choma, you are shaking your head, so let me continue with you then.
I wouldn't say it's more prevalent in Africa or in America. I think, like Dr. Law said, as you age, you start to have osteoarthritis. I've not read where they said your race makes you more susceptible to osteoarthritis, because it's an aging process thing. When it comes to rheumatoid arthritis, it also runs in families, some families. So I don't want to box us into saying it's more prevalent in Africa or here. But what I can say is that the developed countries, they have better ways of treating it. Back home, you see people who are bent over, and you ask them, "Have you been to the doctor?" Says, that means this is as I'm aging, I'm my hip. So if it was here in the developed countries, you go to orthopedic and they will just do hip replacement or knee replacement. But I don't know if they're doing it in Africa right now to help people, but our people don't like to explore. If they can explore, go to all those well-known hospitals, especially the government hospitals where they have different specialties, and the university hospitals where they have specialties. They might be lucky if they have money. That's another thing, financial part of it. If they're able to pay for a joint replacement, they can get it. So I don't want to say it's more prevalent here or there, but it's more prevalent that you see the symptoms there because they don't have the source to cure the symptoms they're having.
Okay, Kina, are you set?
Yeah. Is there anything that people can avoid to help slow the process of osteoarthritis?
Dr. Law.
Yes, I don't know of any particular thing that anybody needs to avoid, but usually because red meat is associated with another form of joint problem, which is the gouty arthritis. It is also important that we limit the amount of red meat we eat and go for white meat instead of regular red meat and all that comes with it. So that's the only thing I believe that we could possibly avoid to prevent issues connected with the joints. Not necessarily osteoarthritis, because that is age-related. It may not have anything to do specifically with the deposits of any form of matter in the joints, like osteoarthritis. So definitely, if you are doing vigorous exercises, you are putting a lot of pressure on the joints, especially the knee. If you ride your bicycles and you ride 20 miles every day, it's going to affect your joints someday. There will be friction between the two ends of the bones and the cartilage involved in it. So at some point, they will be tired of doing that stuff. So moderate exercise is recommended, not very vigorous exercise. And then you are also advised not to stay in one place. You have to be ambulatory. You have to be greasing the joints with proper nutrition and food. But I don't know of any other thing that specifically you have to avoid, except the ones that Okina has already mentioned, like smoking and drinking. In fact, most of the ailments on our body, we have drinking and smoking as some of the causes. There's little or nothing you do that has not drinking and smoking as something you need to avoid. So you need to avoid those, and then live and exercise moderately, eat well, and get good nutrition. Thank you.
Yeah, Dr. Law, before you go, you have told us how we can try to get through, but are there things that worsen arthritis? For instance, somebody told me that cold does worsen it. Is it true? Are there other things that can worsen that ailment?
You mean good?
Cold.
Cold.
Yeah.
I don't really know how cold will be
exacerbated.
Yeah, exacerbated. I don't have that idea. I haven't read it from any journal before. But I know that most of my patients are forecasters. When they come to your office, they tell you that it will rain tomorrow, and it will rain. They tell you that they know usually when it's about to rain. So I don't know how that is connected to the osteoarthritis issue, but I've been wondering. I haven't read it anywhere, Yeah, that when you get older and get osteoarthritis, you become a meteorologist. And then you can now forecast the weather. But I hear it all the time.
That's true.
So if that is the key, and they're always avoiding cold weather. So those who have pain come to my office and say, because of the weather, if my pain is worse now, and therefore I will need you to give me more medication for pain. So somehow they all complain of more pain when they are at home and not moving out. So sometimes maybe because of the cold weather and the snow, they are not leaving the house. And that sedentary situation may be what is causing the pain. So it's one way or the other. It could be both. So that's how I want to express that, my friend.
Dr. Choma, do you have an input on the cold and the heat?
Well, I find it very funny because that's what I hear all the time. And if you go to their homes, if it's supposed to be, moderate weather, 60 degrees, their heat is still on at 90. And I'm like, what is going on here? They're like, if I turn it down, I'm going to feel pain. And they tell you I'm telling you, they're very, very right at the days it's going to rain. They'll say it's going to rain in the afternoon, and I started feeling pain last night. So what I think is happening is just the body's reaction to the humidity and dampness. I think their body just tells them, because of the thin layer of skin. If you look at older people, their fat tissues becomes less. It's not as good as those of you that are young. Dr. Law says he's getting old, so I relate to that. So let's leave it for them, but they're always right when they tell me that. So you see them wearing sweater with 90 degrees, and you come in with a t-shirt, and you're like, what can I do to get out of this house right now? So I think it's just part of life cycle. We'll get there someday.
Yeah, but Law, in Africa, you know that most times, if you go to most homes, most people who are old normally sleep with woods in their houses before the advent of zinc houses. Wherever, any home you went, like I used to go to my grandfather, and every night they must sleep with lots of wood put together, and there is heat. And I used to ask them, why are you doing that? They say the thing helps their bones. I think that could be primitive science, but we need to look at it. I think it may have some credibility in it.
Yeah, that's the same thing. That's the same thing that the chairman is saying. That the older people like warm environment. Their body cannot adjust to. Their skin cannot adjust to change in coldness and all that. So you have to give them warmth all the time. I don't know whether it is directly connected to the bones, but it's connected to their body. That's the temperature they are more comfortable in. So our people in those days, they didn't have heaters, but they had to use lots of wood to warm their house, especially during Hamatan. Our people usually don't like to do things under the pool because they're used to high temperature almost throughout the year. So within that few months, 1 or 2 months in December, people go around the fireplace to warm themselves up. I think it's part of the same thing. I don't think it's different from what goes on here. People use heaters here, even when they can even with their air conditioning unit, they still try to put extra heater instead of doing, especially the older people. So it's the same thing.
We're gonna leave that to Dr. Chioma to do a research on that and bring it to us for another show.
Exactly.
So okay, can I go ahead?
Yeah. Does any of this go away without any treatment? Or let me put it this way, what are the complications if left untreated? Both OA and RA.
Well, OA, if left untreated, results to chronic pain. And no one likes pain. That's number one. Number two, it can lead to depression, both OA and RA if left untreated. Because if you're always in pain, it affects your mental status. You're not going to be a happy person, and you're not going to have good quality of life. That's one of the side effects of having both OA and RA. But also RA, someone who has RA can have chronic kidney disease, because if you become anemic, remember the erythropoietin that comes from your kidneys that produces makes your blood cells produce anemia. At this point, it's not producing it, so you're going to be anemic. And if you're anemic, you can have other things like, your kidneys will be affected, your mental status is affected, you can faint, you can go into all kinds of things can happen to you. So also you might not be able to move around. So for someone like me who likes to I don't like to sit in one place, and God forbid I have any of this, that means I'm bound to the house. I need someone to give me transportation. You need someone to do things for you. So you don't want to get to that point. That's why it's better to diagnose the person early and start treatment early, so that you don't get to the chronic point of it where you will now start to have symptoms that are debilitating. And for females, when they have rheumatoid arthritis, their fingers are bent, their toes are bent, even for them to show it to you takes courage. So it's something that affects, this is a pretty person that you used to see before, and now they're all crooked, bent, undergoing surgery. Financially, it drains your pocket, no matter what you say. So those are some of the side effects and symptoms, down the line.
Yeah, may I add something? Yes. Each time we talk about some of these, taking care of some of these chronic conditions, I remember the appeal for every ill, which is a topic I handled sometime when I was writing my dissertation. So that's one of the complications too. And you begin to take medication every day to run away from the pain. You may develop other problems because every medication you take has side effects, especially the insects, like ibuprofen. If you continue to take it constantly to run away from that pain, you may develop epigastric issues. And then you start having nausea, heartburn, and some of those other conditions. And to take care of that, you start taking some antacids, and you start taking some PPIs to lower the acid level of the stomach. So the side effect of some of those medications may be depression. If you get depressed, you start taking depression medication. And when you take depression medication, you start getting loss of memory. And when you start getting loss of memory, you start looking for medications that will help you improve your memory. Some of these also have side effects. You continue from one disease to another, from one condition to another, till you get completely depressed, because none of those is going to solve the problem and solve them completely. You are rather increasing the problems you have. Then when you go to your medication cabinet, all kinds of medications are there. Some of them, you drink them today, you won't drink tomorrow because you are frustrated. So that is the major complication of immobility caused by arthritis and the depression caused by pain. So we need to watch out for that each time you're taking care of the elderly. Thank you.
Yeah. Let me ask, is it possible to have both ROA and OA at the same time? Can one person have the two?
Yes, I believe so. Mhm.
Right, go ahead.
Yeah, because the OA, osteoarthritis, is basically erosion of the joint. It could still happen whether you have the ROA, which is autoimmune or not. So you can have the two. But the one that is causing the most problems is here the focus. And then this pain to manage that.
No, serious. Is it possible for COVID-19 to trigger off arthritis in your body?
Well, it all depends on what type of arthritis you're talking about. Well, there's so many things happening with COVID now that we can't even, that's still researching on. It's too early for us to zone in on the after effect of COVID. People are coming up with all kinds of problems. So I wouldn't say it's triggering it. It can exacerbate it, like body ache and stuff. And you already have OA, so you have pain to your joints, you have pain to your muscles. So I wouldn't say COVID started it. Maybe you had it before the COVID, and now COVID made it look worse. I don't know if Dr. Law has something to add to that.
Yeah, I don't see any direct correlation between the number of COVID positive tests and the rheumatoid arthritis. I think we haven't done that research yet. But whatever illness you have may make you immobile. And if it makes you immobile and you sit in a place, the joints might get stiff. If the joints get stiff, it comes with pain. And if it comes with pain, you take medication. And if you take one medication, you may need another. So it's it has double impact.
Yeah, Dr. Law, please, before you go, you have raised a very critical issue. This thing makes you a little bit immobile, makes you unnecessary, makes it difficult for you to take medication. But in almost all our programs here, there are very strong recommendations that people must take exercise. Have you figured out how to handle the case of the arthritis patients? What type of exercise can he take or she take? At least to keep body and soul together. Yeah. So how do we handle the case of an arthritis patient? What type of exercise can they take? Dr. Law.
Okay. Yes. We mentioned this some time ago during the course of this discussion that you can exercise in so many ways. There's even passive range of motion that we encourage nurses and aides to do to people who are immobile and who are in their homes. If they can't do active exercise, which is the one they do them by themselves, you do the passive work, which means move their joints around, sit them up, lie them down, turn them to bend down this way, raise their legs and bring them down, things like that. In any way you can help them move their joints, you do so. So, but if they are able to do that, encourage them. You don't have to do it outside. You can stay in your room and move your body around. And we also mentioned that if you have arthritis of the knees, we don't encourage you to do vigorous exercise that means allows you or jogging or some of those things that continue to wear the knees down more. You can do swimming. Then the swimming does not give a lot of stress to the knees. And so many other things. Then you can go to a physical therapist who will now massage your body, massage the joints. Some of the times, the pain is due to the tension of the muscles. And then you have to massage some of those muscles to get them loose. Or sometimes you take flex rail, which is muscle relaxing, or some of the medications in that group to also help the muscle to relax and be able to move around. So that's the way it is.
Okay. Dr. Kuna, do you have anything or do you want me to go ahead?
Yeah, I just wanted to let our audience know that this is our show. It's not just a one-way traffic. We would welcome questions from the audience. so that if you have any question that is burning in your mind, please you can WhatsApp us, or you can put it on Facebook or YouTube, and we will address those questions. Go ahead, Mr. Alex.
Okay. Dr. Chioma, now that we've been talking about this, the complications and how to manage the arthritis patient. So I want to ask, are they hurting all the time? And have you been able to find a way of making them live a normal life despite their health condition? Is it possible? Can they live a normal life?
Well, they can live a normal. That's why we said it's good for them to get diagnosed early, and you have to work with your provider to find a suitable form of exercise so that you can move your body. If it gets to the point, let's say the person is 100 years old and has osteoarthritis, and now hip and knee and back pain and everything, at that point you're slowing down. You're not doing much. That's where social work comes in. We provide them with people to help, go to the bathroom, shower. There are so many gadgets in this country. But if we're talking about back home where we all come from, I don't think they have those things. So, but we have community help. We have great-grandchildren coming to live with grandma to help her bathe and help her eat, help her do things. So you can live a normal life based on your circumstances at that point. But when it becomes bad is when you don't have anyone to help you. You're just by yourself. You don't have medications. You don't have assistive devices. Then that's where you run into some kind of problem. But if you can get anything to help you live a normal life, so to say, at any point, go for it. Life goes on. No matter what the disease is, we've talked about so many disease processes on this show. So osteoarthritis is one disease also that you can handle by working hand in hand with your provider and with people in your team.
Okay.
Wow, that sounds like your last 1 minute.
Okay, we now do our normal ritual, and that is take home 1 minute clip. So let us, Dr. Law.
Yes, I was going to say something before 1 minute stuff.
Okay.
When you watch our battle, even amongst your mates, when you see them walking and you watch them from a distance, you can see that some of them have bent one way or the other. Even you yourself, watch your fingers and all that, they are not as straight as they used to be. Things are, there's a tectonic shift if you want to go that way.
Things are happening.
Yeah, things are happening. So when you are avoiding pain on one side, you move the other side, and then you bend that way, straight that way.
Oh my God.
Sometimes when I get some and see some of my even age mates, you see when they're walking towards you, you see that things are no longer the way they are.
Yeah.
And some of my patients complain that I used to be 5'6" tall, but I'm now 5'4". So there's erosion and degradation that is going on. That's the arthritis we are talking about.
Yes.
So everybody should bear it and take it like it comes, because there's not much we can do about it sometimes.
Yeah.
So that's what I want to add.
Okay, so that's your 1 minute. That's your 1 minute statement. Chioma, can you just drop us a sentence?
Well, Dr. Kina said I gave my 1 minute statement.
Okay, you have already done it.
I'll just recap it by saying, stay healthy, enjoy your age, and just live on. Okay.
Okay. All right.
Now I invite Dr. Kina to round up the show.
All right. So, Mr. Alex, what was your take home for today?
Okay, my take home. you have to stay near your doctor, avoid bad food, and then adjust your life as if the issue comes, because it will essentially come with age.
Exactly.
I just wanted to add, Dr. Law earlier on said sometimes you find yourself bending one side, then try and bend the other side. I found myself bending forward, so I'm more cautious now. So I'm making sure that I stay upright all the time. But anyway, this has been another wonderful show. We have all seen today that arthritis is a debilitating condition due to the impact it has on mobility. The normal use of joints may cause osteoarthritis, and this increases with age. It's inevitable. It cannot be completely be prevented. It also can be associated with, like we saw today, with rheumatoid arthritis and so many other conditions, even depression. But what we have learned today, it's some of the preventable factors that we need to all, I just wish the younger generation are listening to these shows, because they are the ones that would have benefited more on, from this, such as avoiding obesity,
It's not too late.
diet, smoking, lack of exercise. So therefore, we can reduce our risk for arthritis by leading a healthy lifestyle and exercising regularly. Thank you again for another wonderful show. We will see you soon.
Thank you all.